due to the bad weather, the airport is closed. So after she left New Hampshire, it was not possible for her to get into Des Moines, Iowa. So, through the marvels of technology, via satellite, we welcome Senator Hillary Clinton from the great state of New York. All right, we have a little technical difficulty. Come on up here, Barb.
More problems.
All righty, but we're going to be hooked up in just a minute. All right, we are ready. Senator Clinton, can you hear us?
Yes, I can, Kathy.
Welcome to the Heartland Presidential Forum. May I introduce you to Barb? Barbara bet me I was going to mess up her name, and I done lost some money up here today. Senator Clinton, Bob is going to tell you about our campaign for community values.
Hello, Senator Clinton. The people here today believe in community values, the idea that we are stronger when we act together. We think our government should consider everyone, not just the privileged few, and it should enact policies that reflect that belief. But lately, we've been led down the wrong track, whether it's a shameful reaction to Hurricane Katrina, policies that support corporate agriculture and make family farmers have to lay in the dust. We have seen this country dominated by a go-it-alone mentality, and we call this the politics of division. But we know, and you know, Senator Clinton, that America can do better than this. So we want to ask you this question.
If you are elected president, Senator Clinton, would you be willing to make the hard decisions that ensure that we as a country live up to our community values?
Yes, I will.
Senator Clinton, we have questions from community leaders. Will our first group please join us? And the format, Senator Clinton, is the first community leader is going to share with you a story, and then the two following community leaders are going to ask you questions. So please wait until you hear from the second community leader before you respond. Trish, you are.
Hello, Senator Clinton.
Hello.
My name is Patricia Devine Wilder. I'm from Walla Walla, Washington, and I'm representing Washington Community Action Network. My nephew, James, was a dedicated family man. He ran a computer-based business in his home so that he could care for his 3 small daughters while his wife worked out of the home. The family couldn't afford health care for all of the members, so my nephew James went without insurance coverage, even though he had a lot of pain in his neck and his back. James also went without health care, didn't go see a doctor for a long time because he didn't want to burden his family with the large medical bills. When he did go for help, he went to the hospital and he was diagnosed with lung cancer. James died.
Take your time.
James died 6 weeks, just 6 weeks later. He died the week after his 36th birthday.
Thank you, Trish. You are?
My name is Deborah Greenwood. I own a home nursing company in historic Stone Mountain, Georgia. and I am a member of Atlantans Building Leadership for Empowerment. Which is an affiliate of the Gamaliel Foundation. The devastating story you just heard from Patricia Wilder should give us pause. But what should give us even more pause is that some 18,000 Americans die each year because they lack health care. The health insurance industry has created a hostile healthcare environment. It is hostile because if you have a pre-existing condition, a chronic disease, are too old, or have no insurance, then you are unwanted. Senator Clinton, are we not our brother's keeper? For several decades, both political parties have pushed reliance on the private sector while government services have declined. The private health insurance industry has failed us miserably. Senator Clinton, here's my question. Do you believe the government needs to increase its support of Americans, particularly when the private sector has failed us?
Your response, please, Senator Clinton.
Well, first, let me say how touched and moved I am by Tricia's story that unfortunately is all too common, because as you just heard, 18,000 Americans die every year because they don't have insurance. I've been fighting this fight for a very long time, and I know that we have to have a better government safety net. We have to have more cost-effective and higher quality health care for everyone. We have to lower the cost so that people can afford prevention as well as all the range of health care services they should be entitled to. I am proposing a universal health care plan. I don't want to leave any American out. We are going to offer a plan that says if you have health insurance and you're happy with it, there's a minority of people, but that's their choice, they get to keep what they have. But if you don't have insurance, or if it doesn't cover your pre-existing condition, or if it's so expensive it doesn't really do you and your family any good, I will open up the congressional plan. Congress has a very good plan for itself, and I want every American to have access to that plan. If it's good enough for Congress, it's good enough for Americans. Inside the congressional plan, there are more than 250 choices. On average, they cost less than you can get today through an employer or in the private marketplace. For those people who cannot afford it, we're going to provide subsidies through a health care tax credit. We're going to limit the amount of money that anyone has to pay for health care to a small percentage of your income. And we're going to provide a public program choice like Medicare to compete with private insurance. I believe in competition, and we're going to change the way the private insurance companies operate, because I could not agree with you more. They have denied people coverage. They have forced people into bankruptcy. So I will let them stay in business, but only under the following conditions. They have to guarantee coverage to everyone. They have to cover pre-existing conditions, and they have to make it absolutely clear they're going to cover prevention and compete not on eliminating people from coverage by charging too much, but by actually fulfilling their promise of being a health insurance company. So with the
Senator Clinton, thank you.